By far the biggest question that I got after the last video was, what exactly do we do if we're trying to become pregnant and we're on a GLP medication? And honestly, the truth of the matter is that we don't really 100% know, because all that we have to go on is the studies, and usually it's just animal data that we have from the manufacturer studies. So in the case of Mounjaro, in that study on the package insert, it shows that there might have been a slight risk to fetal harm, is how it was worded. It didn't necessarily show a teratogenic kind of effect, but most of those effects were kind of linked back to the mom just not eating enough calories. So that just meant that the baby wasn't getting enough calories. And then so there was secondary side effects because of that. But then they also go on to say, well, you have to weigh the benefits and the risk, and you might want to stay on it if you got really, really bad diabetes. So, obviously it's not like end of the world if you were to get pregnant and then still be on Mounjaro for a week or two. But the biggest question is, well, what do I do? I'm trying to conceive. So in general, I think what most doctors are kind of reverting to is just saying, look, if you're on it, then go ahead and just try and stop it for a few months before you actually plan to start to try to conceive. And I think that's reasonable enough. It's just maybe overly cautious in the most part, because, we're kind of missing an opportunity there. So, so we just have to acknowledge that it's kind of a conundrum, because, we want the GLP medication to restore fertility and get everything metabolically right in the first place. But it's also the same sort of thing that we don't necessarily want it on board for the duration of pregnancy for most people, I would say. So what exactly do I usually tell my patients to do in this kind of case scenario? So usually it's option one, go ahead and start the GLP. It'll start to improve all the symptoms, restore the fertility, cycles start to regulate. And then once they're fairly regular, then go ahead and hold off on the medication and then actively try to conceive. Or maybe option two, where same situation, you start the GLP, cycles start to improve, and then once you get to a steady state of it, go ahead and start testing on a weekly basis with a urine pregnancy test right before your shot. And then after that, you would just make sure that you're not pregnant. And then if you do become pregnant, then just go ahead and stop it after that. I feel pretty confident saying that that's, probably going to mitigate any potential risk of fetal harms that, they showed in any of the trials thus far. But, as always, you want to make sure and discuss this sort of thing with your doctor. If you don't have a doctor, just let us know. We can always help.